Report from the Ending Community Homeless Coalition, or ECHO, is shedding new light on the deaths of some of Austin's most vulnerable residents. This report found between 2018 and 2023, more than 1,000 Austinites experiencing homelessness died. KVUE's Daniel Perot spoke with ECHO leaders about the unhoused mortality report.
It's a first-of-a-kind look at deaths among Austin's most vulnerable.
People are dying too often and too early in our community, and it's entirely preventable.
The report cataloged more than 1,000 deaths between 2018 and 2023. 4 out of 5 deaths were men. The number of deaths has increased since 2018. 6 years ago, an average of 7 people died per month. Today, it's 22. ECHO Healthcare Systems Manager Danica Frere says Austin's rising cost of living and the prevalence of fentanyl is causing the increase.
The more people who are outside and the longer folks are outside, the more folks are going to get sick.
The report found transitioning to stable housing can increase someone's life expectancy by 10 years.
Housing is healthcare, it is the cure, and it works. We just need to get people inside.
Overdoses, accidents, and cardiovascular disease are the leading causes of death. Only about half of homeless people died in a hospital, and just 6% had access to a shelter with a bed in the 6 months before their death.
We don't have enough hospital beds or shelter beds or affordable housing.
Frere hopes to use the data to develop integrated, proactive systems to address the community's needs.
And when we do things like that, we can engage a whole person, look at their levels of care that are needed, and adapt to meet their needs and their choices.
The report's recommendations include increasing affordable housing options, expanding substance abuse services, and improving shelter accessibility.
It's a gap in our community that we can solve. It just is going to take a little cross collaboration and ingenuity.
And that was Daniel Perot reporting. And ECHO gearing up to conduct its homelessness census later this month. The organization says it still needs volunteers to help canvass the city and to count as many people experiencing homelessness as possible in just one night. And that data determines how much federal